Ribeiro-Addy.
Thank you, Mr. Deputy Speaker. The importance of this debate can't be understated because the NHS is in a dire state, and that's largely the result of a severe staffing crisis. Other than the generally inept economic policies that we see from the benches opposite, there's no denying that Brexit has had, their Brexit deal has had a direct impact on staffing and numbers, and that chronically low pay and poor working conditions have resulted in an exodus of staff leaving the NHS to work in the public sector, to work abroad, or leaving the healthcare profession entirely. Now, I'd like to start with one of the most undervalued groups within our NHS, and actually the first that most of us meet in modern Britain, the midwife. The Royal College of Midwives has estimated that they have an existing and long-standing shortage of more than 2,000 midwives. And for every 30 trained, NHS England loses 29 midwives. Vacancies for nurses' positions are estimated to be at an all-time high, with a survey at the start of the year finding that 57% of nursing staff across the healthcare sector settings are thinking about quitting or actively planning to quit their jobs. And we can't blame existing staff with figures like these for wanting to leave, or blame others for not wanting to fill these vacancies, particularly when we see the TUC's estimates that since the Conservatives came to government in 2010, midwives have had a total real terms pay cut of £5,657, nurses' pay is down by £4,310 in real terms, and the pay of all doctors is down by about 7.4%. And we can't forget the thousands of non-medical staff who are often overlooked but integral to keeping the NHS running. The cleaners, the security guards, the porters and the other important workers who, along with the NHS, other NHS staff, have faced real terms cuts in pay since 2010. Is it any wonder that the NHS waiting list is now tipped to be over 7 million? Or when we hear of the scale of the vacancies, can we be really surprised to hear that some A&E patients are left waiting for over 12 hours, or that ambulances are repeatedly failing to meet their target and response times? The staffing crisis in the NHS is having a dire impact on patient safety, and if we're going to tackle the NHS backlog, if we're going to address the crisis in staff recruitment and retention, and if we're going to bring the NHS back to the standard that it has to be at, then we have to first and foremost address pay. And we can't be gaslighting nurses by saying they should drop their pay demands and by sending a message to Putin, which is absolutely ridiculous. We have to pay them what they're worth, and if the government were not aware of what they were worth, then the pandemic should have showed them that. We called them key workers because we couldn't do without them. Yet the government justifies their pay by calling them low-skilled workers. Now, Mr. Deputy Speaker, there is no such thing as low-skilled work. There's only low-paid work. All work is skilled when it is done well, and our NHS staff are the best example of this. Perhaps to the contrary, government ministers who are paid multiple times more, who have delivered little skill in running the country if the cost of living crisis and the economic situation is anything to go by, are completely different because they get paid so much more, and we cannot see their sense of skill in running this country. Now, in the past year, a number of NHS personnel have been taking strike action against low pay, and nurses will be striking later this month for the first time in the Royal College of Nurses' 106-year history, and ambulance staff in England and Wales have announced their strike today. And if that doesn't show you the scale of the crisis facing workers in the NHS, I don't know what does. No one wants to take strike action, least of all the workers in our NHS, but the dire situation of chronic underpayment and poor conditions is leaving them no choice. This government has left them no choice. When we have 27% of NHS trusts operating food banks for their staff, when 1 in 3 nurses are taking out loans to feed their family, and when NHS staff across the board are severely underpaid, of course they're at the point of saying that enough is enough. And no one goes to work for the NHS for the money, but it can't be fair to expect them to be living on poverty wages. Mr. Deputy Speaker, if the government wants to address this crisis in recruitment and retention, they need to get over this ideological aversion to paying public sector workers what they're really worth, and that means committing to a real proper cost of living pay rise and setting out plans overall to reverse a decade of real terms cuts in pay for our NHS workers.